If you've been paying attention to some of the news stories about Zika, well, you can get yourself ensconced in some of the rather frightening details of that. This is a situation they're trying to contain health-wise, and we've seen competitive sporting events and things move to try and minimize risk of exposure to this, and so it seems timely to ask Dr. Richard Van Enck to join us, Director of Infection Prevention and Epidemiology at Bronson Healthcare, and he's with us this morning. Good morning, Doctor.
Good morning.
Thank you for your time today. What is Zika? Let's just start there.
Yes, Zika it's a virus, and it's been around for quite a while. We've known about Zika virus for many years. We thought that it was located primarily in Africa, and it was a virus spread by mosquitoes, and the primary hosts of this virus were primates, apes and monkeys and so on. It seems to have changed, and it's changed in several ways. For one thing, it has spread. It spread from the center of Africa into South America and Central America. So that's new. And now it also seems to infect humans. That's new. And it causes a particular type of disease in unborn children, and that's new. So it seems to be an old virus that's learned how to do some new things.
So this particular situation is one in which the progress seems to have been somewhat slow, but now even this week we've heard stories about folks displaying some characteristics of it in Michigan. So this thing's got traction.
It's true. It didn't appear to be much of a threat last year. We keep track of all of these things, and we do surveillance, and so we say what could be a problem for the United States and for the world. This was not on our radar, and so it kind of emerged quite quickly, and so now we're scrambling to get ready to address this new threat.
So how do you do that? How do you address it?
There's a couple of ways that we're working on in terms of things that we don't know how to do now or things that are not in place. One of them would be a vaccine. It should be a fairly easy virus to make a vaccine against. And so it should not take too much work to produce a good vaccine. Of course, it takes a lot of time and money for a drug to come out and come to market. But in terms of the technical parts of it, it should be a fairly easy thing to do. We also don't have any antiviral drugs to treat this virus. But again, there should be ways to do that. We know a lot about it, so it's just a matter of making these drugs.
Well,
so it should be doable.
As we've seen, generally, we are just reactive with this sort of thing. If there isn't an imminent threat, then it doesn't seem to make sense to put the resources into trying to fight it.
Exactly, and that's why we have to have kind of an ability to ramp up and rapidly respond to things like this. Some of the threats we face are constant. They've been the same for 100 years, but we always have to be aware that there's that other group of threats that are new, and we have to be able to respond to that. And the United States is not very good at that. And so we tend to be reactive to crises instead of proactive. So that's the situation we're in right now.
When we come back in a minute, we'll talk about what the symptoms will be if Zika is present, if we can even tell that. We'll talk about that coming up in just a minute on WBCK. Dr. Richard Van Enck is here from Bronson Healthcare. We're talking about the Zika virus. So what does it do? What does Zika do to people?
Yeah, in most cases, the people that have been infected don't know they've been infected. It's a very mild case. So probably 3/4 of the people that have been bitten by a mosquito and infected with this virus never knew it. The problem comes in the 25% of the people that do develop a symptomatic disease. And so the symptoms would be things like a headache, a rash, generally on your abdomen and your back, and so it's a fairly mild rash, some muscle aches and things like that, fevers. So it's pretty non-specific symptoms. It looks like a lot of other things, and so there's nothing really specific about it that you would look at somebody or you would say, wow, that person has Zika. You would say, well, they could have a lot of things, including Zika. So the problem with the diagnosis is that it looks like a lot of other things until the patient is tested.
Wow. So, yeah, I mean, you know, a headache or body aches, you could say I have a cold or I have a flu.
Exactly.
So if you decide or reveal that someone does have Zika, what's the approach here with no vaccine for this? What do you do?
For non-pregnant patients, it's a relatively mild disease. That is, simple drugs for pain, hydration, rest, things like that. So it's a week-long disease, kind of like influenza, and you'll get over it. And it's not a particularly significant disease. All the risk really is in the pregnant patient and specifically in the unborn child, because that's where the new pathology occurs, and that is that the virus seems to stop the development of the brain at the point at which the person was infected. And so we call that disease microcephaly, which means small brain. And so the brain stops developing, and so whatever point of development the fetus was, that's where it stops, and the baby is either miscarried or the baby is born full term with a severe neurologic deficit.
I see. So this is where the concerns about infections of pregnant women come in.
Exactly, yes.
Yeah. All right. So I think what you're saying, though, is for a non-pregnant recipient of Zika, this is not that big a deal.
Exactly. The CDC probably will not even test a patient that is not pregnant because there's no clinical significance. There's nothing that can be done, and by the time you get the test result back, the patient will have been recovered, and so there really isn't any point to spending the time and money testing people for a mild disease that doesn't cause any side effects. So the only significant situation is in the pregnant female patient.
Mm-hmm. And once a child is born who has Zika, there's no further treatment then, is there?
Exactly. That child is going to be the way they were born for the rest of their life. Yes.
Okay. Now you see the concern and where some of that comes in. In a moment, we'll talk more about that. 8:20. Show here with Dr. Richard Van Enck, who is the Director of Infection Prevention and Epidemiology at Bronson Healthcare. We've been talking about Zika. So now we probably have frightened expectant mothers out there. If someone's listening who's expecting and, this story is looming out there, they might be a little nervous about it. What should they do to try and prevent this?
Yeah, there's a couple of things that we know work. One thing is that the primary method of transmission of this virus is mosquitoes. And so it seems to be located so far only in South and Central America. And so if you don't go to South or Central America, and if you don't get bit by mosquitoes, you have no risk.
Okay.
And so the primary things are travel advisories. And then if you do decide to go to one of those areas, make sure that you use good mosquito protection, good mosquito repellent. Stay inside, in air conditioning, and don't expose yourself to mosquito bites. So that would be the primary thing. Now, a new thing that we've just recently started to appreciate is the sexual transmission of this virus.
Right.
Because it looks like for a short period of time, if you have Zika infection, the virus is in your blood and body fluids. And so we do know that men can transmit it to their sexual partners for a period of time. And so if you're a female and you have a sexual partner, and that partner has been to South or Central America and could have Zika virus, you have to keep that in mind as well. And so the CDC is recommending things like abstinence and condoms and things like that for that risk period.
Right.
So that's the new thing that we've just recently learned about Zika virus.
And you said for a period of time
Yes.
that person could transmit it, not forever.
Not forever. At this point, the CDC is saying 8 weeks. And so that's quite a while, but it's not forever.
Mm-hmm. And that would be after the initial bite and the onset of it.
After the person returns from South or Central America, that period of time, they need to take those precautions.
Okay. Well, we certainly have heard about other mosquito-borne ailments and things, and the recommendations have been similar. You know, use those mosquito repellent things. Those things tend to work pretty well, do they?
They really are, and we've got some new technology now that we haven't had before.
Mm-hmm.
That seems to work very well. And I'm speaking specifically of mosquito repellent clothing. You can go to sporting goods stores now, Cabela's or whatever, REI, and you can buy mosquito repellent clothing that's permanent. That is, it never washes out. And you can also buy sprays and rinses that you can spray your clothing with mosquito repellent, and it lasts for several washes. And so it doesn't just have to be applied to your skin. You can protect your skin underneath your clothes as well with some of these new products. So it's really quite impressive if you look at protecting yourself against mosquitoes. There's a lot more products on the market now than there were when I was a kid.
Okay. So let's suppose a male or female does have Zika and the vaccine comes to pass, which probably it will. If they're not expecting and they don't plan on having children, do they need to be vaccinated?
At this point, Zika seems to be associated only with South and Central America.
Yeah.
But the big risk is, the thing that we're most concerned about, is that the type of mosquito that can spread this virus also exists in the southern United States. So the thing that everyone is afraid of is that if that virus enters the mosquito population in the southern United States, this could become a normal or endemic disease for the United States, and that would significantly increase the population that might want to get this vaccine. Right now, it would be like a travel vaccine that you would only get if you were traveling to that country. But if the virus becomes established in the U.S., then it might be part of normal of vaccines that everyone gets.
Mm-hmm. Is there any notion about generally how long it might take to bring this vaccine to market?
It's hard to say. You know, there are investigational vaccines that could possibly be done in a year or so. We saw that a little bit with Ebola and so on. So depending on where they start from, they might be able to build a vaccine in a fairly short period of time. But then to take it through the clinical trials and make sure that it's safe and it's effective, that takes years. Sure. So I would say an emergency product, maybe a year or two. Something that's really completely tested, maybe 3 or 4 or 5 years.
Insofar as you know, the development of such a thing must, we presume, displace work on something else. Is that how this works? I mean, all of a sudden somebody says, oh, move the Zika priority up.
That's a great question. I mean, that gets into a real interesting controversy as far as how we prepare ourselves for these new threats, and basically it has revealed a problem that we have in the United States, in the sense that most people or most groups are handling this very well. The single group that is not handling this very well is the United States Congress, because as you might know, the CDC asked for funding to address Zika, and Congress said, no, we're not going to give you any new funding for Zika. You have to take it from the Ebola project.
Oh, wow.
Well, the Ebola project is still going on. Ebola is still a threat. So you're robbing Peter to pay Paul. And so the whole idea of emergency preparedness is that you're prepared. And so if you have to, shut down one project to move to another, that's not a good thing. And the other thing about virus, studies and vaccine development is that these are all specialized teams of scientists.
Right.
So you just can't transfer the group of scientists and medical personnel from one project to another. immediately. It takes years to develop that skill set and those competencies. So you really have to chew gum and walk at the same time. You have to be able to handle more than one threat. You can't just say we'll shut down one program to start another. So that's kind of the national and political picture behind the scenes that's going on with Zika.
Boy, I guess we can find politics in just about anything, can't we? Well, we appreciate your settling us down a little bit about this thing, and we'll stay in touch. Thank you.
Thank you.
Dr. Richard Van Enck with Bronson Healthcare. 8:30.